Okay, hello dear student. Today in this class, I am going to discuss about a new topic called parasympathomimetic drug. In previous classes, I have discussed about different nervous system, their classification, and I have already discussed in previous classes about what is autonomic nervous system and what are their classification and what are the different type of drugs generally acts on autonomic nervous system. In all the drugs are classified into different parts. Whoever is working on sympathomimetic nervous system, they are also classified into two parts. One is sympathomimetic drugs and another one is sympatholytic drugs. In previous classes, I have discussed about both parasympathomimetic drugs and also sympatholytic drugs. But from today, we are going to discuss about the other two classification of drugs which generally acts on parasympathetic nervous system. So in previous classes I have told you or I have discussed about sympathomimetic drugs and sympatholytic drugs, that both type of drugs generally act on the sympathetic nervous system of autonomic nervous system. Mimetic generally used to induce the action of sympathetic nervous system, and lytics are generally used to inhibit the or block the action of sympathetic nervous system. So today we are going to discuss about the another classification of drugs which generally act on the autonomic nervous system, but especially in autonomic nervous system that drug generally act on parasympathetic nervous system. So how the drug will act on parasympathetic nervous system, by that also drugs are classified into two parts. One is parasympathomimetic drugs, another one is parasympatholytic drugs. Today in this class I am going to discuss about mainly upon parasympathomimetic drugs. So let's go into the main topic of today's video. So that from name only you can understand, in previous classes also I have told mimetic is means to copy the action of someone is called as mimic, and from then name only you can know mimetic means copy, and that parasympathetic is come from parasympathetic nervous system which is also a part of autonomic nervous system. So that by the name only you can understand these are the kind of drugs they generally acts on parasympathetic nervous system, and their action is same what is to be done by parasympathetic nervous system, and all that action is generally done by a neurotransmitter called acetylcholine that is generally released by the different type of parasympathetic nervous receptor which I am going to discuss now. And you can from previous year or previous classes also you can know that in parasympathetic nervous system there are generally some receptors which used to act or used to help in the action of parasympathetic nervous system. That receptors are generally known as cholinergic receptors. That cholinergic receptors are also classified into two. One is nicotinic receptors, another one is muscarinic receptor. And I told about previous classes that nicotinic classes also are differentiated in subclasses of nicotinic receptor which are muscle type and nicotinic receptors which are neuron type. And in muscarinic receptor also 5 types of receptors are there: M1, M2, M3, M4 and M5, where all that receptors are present. According to that their names are being classified, and all their position and their action I have already discussed into the previous video. So to know where all that receptors are present, you can refer my video about the introduction of autonomic nervous system. So by compiling all that knowledge from previous class and whatever I told in today's class, you can understand that parasympathomimetic drugs generally show their action the same as of parasympathetic nervous system of ANS, and they show their action by binding with different cholinergic receptor, which type I just discussed on, that were nicotinic and muscarinic. So now we will discuss about the different physiological action of sympathetic nervous system, or that can be also replicated by the parasympathomimetic drugs, that I have already discussed into previous classes, but today also I am just rewinding or remembering all this process, so you can better understand the topic parasympathomimetics, and next class parasympatholytic. So I will discuss again about the physiological action of parasympathetic nervous system. So what are their psychological or physiological action? Their physiological action is depend upon on which system or on which organ they are generally used to act as. So first one is CVS or cardiovascular system, that includes different blood vessels, heart and all these things. The main action of parasympathetic nervous system or cholinergic receptor is to direct the construction of AV node. That means it generally promotes the vasoconstriction. That is also used to decrease the BP or the blood pressure. So it is also used to treat blood pressure or hypertension. The next physiological action, which is shown by parasympathetic nervous system on eye, constrict the pupil. And that constrict of pupil is also known as meiosis. So in parasympathetic nervous system in eye, it generally helps to constrict the pupil, and that constriction of pupil is known as meiosis. The next physiological action is on respiratory system. In respiratory system, it generally helps in bronchoconstriction. So what they will do in respiratory system, they will generally do bronchoconstriction, that sometimes may leads to the asthma. Now the last part, where generally parasympathetic nervous system or cholinergic receptors show their action, is GIT. In GIT, what they generally used to do? In GIT, generally they used to promote the peristalsis of intestine, and it also used to increase the tone or motility of gastrointestinal tract, and it is also promote the secretion of saliva, the secretion of different hormones and different secretions from liver, pancreas, etc. So these are the short psychological action that are shown by parasympathetic nervous system by the help of cholinergic receptor. To get into the details about the psychological or physiological action of autonomic nervous system, in that details comparison between parasympathetic nervous system and sympathetic nervous system and their physiological action, you can refer to my previous video about the introduction of autonomic nervous system. Now we will go to discuss about the different therapeutic activity or different therapeutic usage of this kind of drugs, which are called as parasympathomimetic drugs. But from the psychological or physiological action, you can relate that parasympathomimetic drugs actions are almost equivalent with the sympatholytic drugs. So whichever action generally showed by sympatholytic drugs, that same kind of action is promoted by parasympathomimetic drugs. So their physiological action is almost kind of same. It is very easy to remember. To remember their action easily, you just have to compile, or you have to just compare that the physiological action of sympatholytic drugs are almost same kind of action that is applicated by parasympathomimetic drugs. That means that is ulta kind of action. So now we will go to the next part of therapeutic usage of this kind of drugs. That drugs can be used to treat glaucoma. In glaucoma, to treat glaucoma, generally two drugs are generally used from parasympathomimetic drugs. They are physiostigmine and pilocarpine. These drugs are also used as the therapeutic effect to treat myasthenia gravis. What are all that disease I will discuss later in upcoming classes. Then you can better understand that. To treat myasthenia gravis, the drug generally used is neostigmine. That parasympathomimetic drugs are also used to treat or used to act as the antidote for atropine poisoning or curarine or curine poisoning. So these were the some actions of parasympathomimetic drugs. What are they? They used to treat glaucoma, they used to treat myasthenia gravis, they also used to treat or as an antidote for the treating of poisoning done by atropine or curine. That means parasympathomimetic drugs also can be used to treat or use as an antidote for the atropine and curine poisoning. That parasympathomimetic drugs also used to treat or used to control Alzheimer's disease. That all Alzheimer, what is myasthenia gravis, what is glaucoma, all these disease we are going to discuss into the upcoming classes. Now we will discuss about the different adverse drug reaction showed by parasympathomimetic drugs. The most common is nausea, that means feeling of vomiting, and sometimes it can cause real vomiting. When you are starting to use that parasympathomimetic drugs for an extended period of time, that can also lead to the side effect of bronchocardia, or that is also called bradycardia, and sometimes also they used to cause hypotension when the parasympathomimetic drugs are taken into the extended period of time in excess. And sometimes also they used to induce asthma. So these all are the different adverse drug reaction related to the parasympathomimetic drug. What are they? They are nausea, vomiting, bradycardia, hypotension when they are used in excess amount for the extended period of time, and also it can induce asthma. So these all are the adverse effect related to the overuse of parasympathomimetic drugs. At the last, we'll discuss about different drugs or different example of parasympathomimetic drugs. What are they? Some example is physiostigmine, which generally used to treat glaucoma. Then there is neostigmine. that is used to treat myasthenia gravis, and that both also used to treat atropine poisoning. Then we have pilocarpine. Then some example is carbachol, and one more example is betamicol. So these are the some famous example of parasympathomimetic drugs which are generally used by us in our daily lives or to treat some drugs that I have already discussed in previous topic or the previous slide. So these are about parasympathomimetic drugs. In the upcoming classes or into the next class, I will discuss about the parasympatholytic drugs. Go through all the topic about parasympathomimetic drugs so you can better understand the topic of parasympatholytic drugs. So in this video I have already discussed about what is parasympathomimetic drug, what are their action, how they generally show their action, what are the physiological action of parasympathomimetic drugs, what are the therapeutic effect or therapeutic usage of parasympathomimetic drug. Then I have discussed about the adverse drug reaction due to the overuse of parasympathomimetic drugs, and at last we have discussed about some important or some famous drug which is generally used in our daily life as parasympathomimetic drug to treat glaucoma, myasthenia gravis, Alzheimer's disease, etc. For today, that is enough. Next class we will discuss about the parasympatholytic drugs. Thank you.